Today is World AIDS Day, a day set aside to focus on addressing the inequalities that drive this epidemic. Well, here in Nigeria, the federal government has approved the disbursement of $200 million to support the HIV, tuberculosis, and malaria program. The First Lady of Nigeria, Oluremi Tinubu, while speaking at an event organized to commemorate this year's World AIDS Day, revealed that the federal government is focused on strengthening local sustainability of HIV response. The First Lady also called for an end to judgment and discrimination.
This year, in partnership with the Organization of African First Ladies for Development, OAFLAD, the Free to Shine campaign was launched across all the 6 geopolitical zones in Nigeria. This campaign promotes the triple elimination of HIV, hepatitis, and syphilis by 2030. However, Nigeria's HIV response remains largely donor-funded. As global funding patterns shift, we must ensure sustainability to prevent disruption of critical services. As we move forward, I call on all Nigerians to support the renewed hope agenda of His Excellency President Bola Ahmed Tinubu, GCFR, in the commitment to achieving an HIV-free Nigeria by 2030.
The National Coordinator of People Living with HIV and AIDS in Nigeria, Abdul Ibrahim, joins me to discuss and talk about the National AIDS Day. It's good to have you join us at this time.
Thank you very much.
I mean, the World AIDS Day is, another opportunity for us to raise awareness about some of the issues facing those living with this illness. Let's start off with what it's like as the National Coordinator leading a network of those living with this condition.
It's normal, and I don't really feel anything strange because it is something that I personally overcome for many years, and we are encouraging a lot of people, and the treatment is available and is working. And with effective treatment, you don't pass the transmission to any other person. So with that, I think we are good to go.
And how well would you say Nigeria has really, been able to handle the growing number of cases that we've seen? But first off, let's talk about how common you think HIV and AIDS really is in Nigeria, across Africa, and describe the government response to this.
So Nigeria, as you know, is one of the key or leading countries with AIDS epidemic. But our statistics have shown from our NAI survey, which we have recorded a significant number of reduction, even in terms of prevalence, from about 3.5 to about 1.8, which is quite improving. And from the government initiative of getting the data right, it has drawn the number of people on treatment from 2 million to 1.6, and later on now we have accelerated it to 1.8, who are currently receiving life-saving treatment, which is also very impressive.
You firsthand, experience this. Let's talk about, some of the challenges that you think people living with this illness still face as we celebrate the World AIDS Day.
The challenge is basically affecting people living with HIV. Basically, is the lack of the fear of uncertainty, most especially the withdrawal or the reduction in terms of donor support, which is really clearly on the wall. The US government, if you observe, they did not even participate in the World AIDS Day event throughout, and there was a circular from the White House that no US government partner or an implementer or even any agency should participate. So that's a big challenge. This is a moment of solidarity to show love, care to people living with HIV, and to also raise awareness to others to know other prevention measures to be able to protect themselves against the HIV. So one of the major challenges is that fear, because we have seen donors are withdrawing their support basically gradually on HIV, and leaving everything in the hand of government is going to be a quite challenging. We need to go. The president has a commitment this year, allocated some quite significant amount of resources that worth over 200 billion naira to procure commodities. But beyond commodities, there are other social issues affecting people living with HIV. One is the stigma and discrimination, which is a key barrier. If not been addressed, at some point it will limit people from going to facilities or even community to access these services. So it's one of the key measures that is really affecting people. And also the community level work that we are doing in terms of mobilizing and providing linkage. Most of these are also funded through donor communities. And the US government has also withdrawn a lot of support for community-led interventions, especially testing. So apart from government now that we are looking up, there are no community testing happening across the country. And it will be very difficult to be able to identify people and place them on treatment. So I think it's a big challenge that I think that we really need to pay attention to that.
I mean, funding is another concern. We've seen the president of South Africa also raising concern as this. South Africa, one of the major nations battling with this form of illness. The Nigerian government has approved $200 million US. We look forward to how far that will go for people living with this form of disease. That's a fine place to leave it for now. Thank you for talking to us. Abdulkadir Ibrahim, National Coordinator, Network of People Living with HIV and AIDS in Nigeria. Thank you for joining us on TVC News.
Thank you very much, and do have a wonderful day.
Right.